Today is when I've learned there is a clinical customer relations manager. I could be very wrong. If there are any facilities that don't have such kind of positions, I think it's good to have that because there's actually a specific now docket that discusses these things with the patients, right?
Remember, healthcare is very complex. And remember, at the end of the day, a complaint will arise because a patient might not have understood what is being done, what is the process, why is it being done. We have the public relations officers, we have the corporate communications officers, but mostly not with a clinical background. They might not understand the questions that these clients want to ask or the patients want to raise, and eventually they still have to come back and ask a clinical person, what does it mean? Why are we not doing this? Let me give an example of a patient who comes with an acute kidney illness and needs to go for dialysis. But that patient you find says, you people, you guys, you just tell me I need dialysis, but my problem is not the kidneys, my problem is the abdomen. One role is to deal with complaints, compliments, and concerns so that we are proactively handling them and they don't necessarily have to get out to media.
Beautiful. Which now makes me ask this question. If patients could see what nurses usually see behind the scenes just for one day, what do you think would surprise them the most? If you've ever been admitted in a hospital, chances are the person who reassured you, checked on you the most, and made sure you were safe was a nurse. Welcome to Kay's Wellness Center podcast, a space where we have honest conversations about health systems and the people working every day to make healthcare safer and more humane. Today's episode is quite special as we reflect on the critical role nurses play in our healthcare systems. We are joined by someone who embodies leadership, resilience, and compassion in nursing. My guest today is Ms. Doris Kinya, a nurse working in clinical audit and clinical customer relations at Moi Teaching and Referral Hospital. She is a passionate advocate for patient safety, an eloquent speaker, a researcher, a pastor, a mother of three, and someone whose academic journey has been one of perseverance, taking about 10 years to complete her master's degree, despite many moments where giving up seemed easier. But what makes this conversation powerful is that nurses are often the quiet guardians of our healthcare system. They are the ones closest to patients, the ones who notice when something is not right, the ones advocating for safer care, often behind the scenes. Today, we will talk about patient advocacy, antimicrobial resistance, the realities of working in a large referral hospital, and the role nurses play in protecting patient safety in Kenya. Doris, welcome so much to the Case Wellness Center podcast, and I'm really excited to have this conversation with you. So, to start with, I have news on the background that Doris is a smiling machine. So, where does that joy come from, despite working in such a demanding profession?
Well, thank you so much, Dr. Jacqueline, for having me here. It's a pleasure. And to get an opportunity to share about the insights on how nursing is engaged in every patient that they take care of. And well, I just derive joy from just being alive. There is always a reason to be happy. It depends on how you look at life. And despite the kind of life that we pass through and the challenges that are there is always an opportunity to be happy and also to share that joy with someone else. Yeah.
I think it's majorly because we tend to focus on bad things, negative things, and just things that are disturbing us. So we even don't get to enjoy the things that are just within and around us. I'm also aware that you have a very beautiful singing voice, right? I think you should sing for us something at this point. Has music ever helped you cope with the emotional weight of nursing?
Has a way of just making life bearable. It has a way of bringing things into perspective. It's also a way of just giving your mind a rest to the many things that we think through. And many times you find that life has a way of making sure that you're always busy thinking, making plans, with no time to really, if you don't choose a time that you want to give to yourself, you will actually find none. But music has a way of making you stop fast and see life in another different perspective. It has a way of expressing our emotions. Many times you find that em- being emotionally intelligent means stopping and re-examining your life, your feelings, and managing them. And music has just a way of doing it, giving you hope, um, telling you something about life, and many more. And I think just especially when I sing gospel and worship, it just has a way of just uplifting my spirits and making life look much more bearable. Look, yeah,
That's beautiful, eh? So I'm imagining you also, do you sing to
yes.
your patients and also pray for them because you're a pastor as well?
There is always a time that you get to engage with our clients and give them that hope. Make sure that the faith that they have does not dwindle away. Remember, at this time they are very vulnerable, and I remember sometimes back when I used to be a bedside nurse, I would really love putting music and listening to it, and the patients would always be like, "Do you sing?" And I'm like, "Yes, I do sing, and I love singing. I'm an alto." I'm a natural alto, though I'm told that I can sing a high soprano. Music, life is just music by itself. Depends how you look at it.
Some of, some of us have frog voices. If you start singing, it's like we are those people who used
Yes.
to be told, please, Jacqueline, stand up and lead us in a song. Please don't listen to the voice, just listen to the words. Thank you. And then you start singing.
If you keep on practicing, it just comes out actually.
Yeah.
It's not about the voice, actually, Dr.
Yeah.
When you just start singing, I remember there's a time that I would always say, if I am afraid of singing in public, I would rather go and sing in private, but just sing it loud. And many people are just used to putting the voice out there when they're alone, and they find quite a lot of satisfaction just doing that.
I'm imagining, Doris, the kind of impact that you usually have in just your community. Yeah? Because being a pastor, being a lady, I presume maybe you were in the choir
Mm-hmm.
once upon a time, being able to sing and
Mm-hmm.
joyfully so, and also being a nurse, the kind of impact that you've
Yes.
actually managed to have, not just on patients in MTRH, but also in your community. That must be quite something for you.
I have got an opportunity to be able to mingle with the youth in the society. I lead praise and worship group in my church, and also I'm involved in a lot of community activities, including outreaches, doing crusades. reaching out to people in the society in one way or another, as well as doing school ministry. We have a team that we go out there, reach out to schools, sing with students, be able to reach out to them, do career guidance, and it's quite something when you're able to give up a part of yourself and also to mentor the generations that are coming up, because they're going to be a lot involved in the near future. I also have a chance of getting out there, and I'm invited in conferences to lead worship, to talk to women and girls, and also to sometimes to go to schools. I'm also invited by some chaplains, and I'm able to get out there, and we discuss things. You find that when you get you create a rapport, or you get into a certain special relationship with these young children, that they open up to you. They're able to talk to you about their life, what they're going through, things that they are unable to talk about.
That's quite beautiful, because every day we are given the opportunity to serve, and especially in the healthcare sector, we really
Yes.
have the gift and the space to not just serve our patients and our clients, but also the community, our families, our friends, our relatives, just by the fact that we are in the healthcare sector. So many people usually see nurses as caregivers, but not really as system leaders. What would surprise the public about the role nurses usually play in hospitals?
Many times you'll find that a nurse is the first contact every time that a patient walks in through that door. The first person that they're likely to meet is a nurse. Even after being reviewed by the doctor and the care that is going to be given, it's usually provided by the nurse. Therefore, you'd find that nurses are the first contact for patients and act as frontliners. They're advocates that ensure patient needs are met and patient rights are upheld.
Sijui pia hapo katika usalama wa mgonjwa tunalolizungumzia swala, pia kuna haki zake ndani.
So kuna haki za mgonjwa ambapo anakuja, unapata ya kwamba mgonjwa akona rights ambapo anafaa kupewa information kaa yote kuhusu ugonjwa wake, matibabu ambayo anapata, atapata kwa muda gani, na mgonjwa pia akiwa na maswala anafaa aulize. Maanake unapata katika hii safari ya ugonjwa huyu mgonjwa yafaa kuwa ayuko, sio sisi peke yetu kama wenye wanatoa huduma ambapo tunamwelezea. Pia naye ako na haki ya kutuelezea angependelea kuhudumiwa kwa namna gani. Ndiposa ndio tutembee safari kwa pamoja.
And that is why a nurse has a very major role of nursing management. We call it nursing management because it's more than just caring for the patients. It involves assessing those particular patients as an individual who has an autonomous training in regards to patient care. Also, secondly, they check for assessment of cues and plan their care. It is a systematic and a very scientific manner of planning care, depending on individual needs of every patient. And after that, they address the needs, they explain to the patients, they get a lot of time to interact with them, to understand them, as well as to be able to guide them accordingly to the care that they are supposed to continue. Because remember, these patients, as much as they're coming to you, they have a time that they will leave and they are going to continue taking care of themselves. Therefore, advocacy is something that starts from nursing education, we call it Foundation 101, the very first units that you do in the colleges or universities, where you learn how to advocate for this patient, walk the journey with them, be able to place yourself in their shoes, and also being able to create a rapport in terms of creating an emotional and psychological way of communicating with them. And they have also a reason to empower those particular patients and their families. You find that in every unit, the person responsible for managing and leading that unit is always a nurse. They are the centerpiece to any healthcare system. They are the ones who coordinate multiple specialties that are supposed to review one particular individual and making sure that every need, be it the clinical management, be it plan of care, be it imaging, be it nutrition, be it physiotherapy, all these are coordinated by a nurse.
Could you maybe share like a real life experience or a moment where the advocacy you're speaking about actually made a real difference for a patient?
Yes, I will. And I would say a patient who, for example, speaking about Moi Teaching and Referral Hospital, which is a level 6 healthcare facility in this nation, a patient who walks through emergency department and comes from one of the 27 counties that we handle and we offer care to. It is a facility that has sees patients referred from over 27 counties in this nation. And all these patients, you can imagine coming to a new place, not understanding what you're supposed to do, where you're supposed to start. A nurse is the one who will triage you or actually assess you once you enter Moi Teaching and Referral Hospital. Then they're going to refer you to a doctor's room where you're going to be clerked. And after all this, there are so many processes and steps. There is a laboratory where you go for investigations. There is a radiology department, and all these are placed in different areas. And this particular patient coming from one of those far places, I've never been to Moi Teaching and Referral Hospital, you'll find that it is a nurse who advocates for them. In my role as a clinical customer relations manager, one of the things that I usually do is to ensure that I talk to every patient in the hospital that I come across, and I get to understand what are their concerns in care, what do they wish to be done, and they're not understanding why it's not being done. And you get time to explain to them as why they are going through a certain period or a certain plan of management. And where need be, let me give an example of a patient who comes with an acute kidney illness and needs to go for dialysis. But one of the symptoms that brought them is pain in the abdomen, and they're not understanding why are we being told to go for dialysis. And eventually that patient, you find, says, you people, you guys, you just tell me I need dialysis, but my problem is not the kidneys, my problem is the abdomen. And you advocate for them by ensuring they get to meet and interact with the clinician again afresh, for them to be able to explain to them why are we going for dialysis, what are the symptoms of kidney injury, and why are we saying, and what do you expect to see when you do the dialysis. So it's a nurse who comes in between and links the specialty to be able to reach out to that patient, as well as explain what this patient wants to ask. And you'll find that many times the clients don't know how to approach and ask the questions that they have. But if they're able to open up to you, then you're able to talk to the person, to the responsible person, link them up, and ensure that they are able to understand what they are being treated for, how is the management, and what are the expectations at the end of the day. Remember, healthcare is very complex. And remember, at the end of the day, a complaint will arise because a patient might not have understood what is being done, what is the process, why is it being done. And when you as a nurse, you come in and advocate for them by also telling the clinician, the primary clinician, that I think this patient might not understand why we are doing what we are doing. We need to come in together, all the specialties that are taking care of them, and handle the complaint. And at the end of the day, the complaint is resolved, and we find our clients go home very satisfied.
Beautiful, just to say the least, because most of the times we are in the back end, like us, you take, clerk, finish, give instructions, and disappear. Most of the times we never have the back end information of what is going on. And it's always important for the public to also know who is this person that you can approach, who is this person that you can reach out to, talk to, because they also have the time for you to do this. And also, I think the one thing that also I know we are still understaffed in most of these hospitals, but also a beautiful thing is that nurses in most departments are usually, let me say, the highest number compared to maybe clinical officers, medical officers, lab technicians, etc. So it gives more space and room for you to provide that advocacy, that guidance, that rapport, that coordination to each and every need. That is beautiful, actually, what you do. Today is when I've learned there is a clinical customer relations manager. I'm learning something new as we continue, and I think most, if not, I could be very wrong. If there are any facilities that don't have such kind of positions, I think it's good to have that because there's actually a specific now docket that discusses these things, the patients, right?
Having a clinical customer relations manager, we have the public relations officers, we have the corporate communications officers, but mostly not with a clinical background. They might not understand the questions that these clients want to ask or the patients want to raise, and eventually they still have to come back and ask a clinical person, what does it mean? Why are we not doing this for this particular patient? And you find that getting a person with a clinical background, we are able to explain to them without necessarily interfering with the complex processes that are still ongoing. We are able to walk the journey with these patients. And I always like saying in this clinical customer relations manager job, and one role is to deal with complaints, compliments, and concerns, so that we are proactively handling them and they don't necessarily have to get out to media.
Beautiful. Yeah. Which now makes me ask this question. If patients could see what nurses usually see behind the scenes just for one day, what do you think would surprise them the most?
It would they would be very much surprised at a role that a nurse has to play from the time they get to work. It just doesn't translate. Many times people think that it translates to them working under a medical officer or a doctor or a surgeon or a clinical person. But they will get to understand that nursing is a very autonomous profession, and we are able to work as a team, because even if a clinician has seen a patient, has made a plan, there has to be someone to ensure the patient is safe while executing the plan, and to ensure that this particular patient feels heard. They are part of that care.
Amazing. Now, even as we continue this discussion, one of the biggest threats to patient safety globally right now is antimicrobial resistance. And I know we're having this conversation globally, in the African context, and even locally. And nurses are actually usually at the front line of this issue. As you rightfully said, by the time that patient walks into the clinic, into the healthcare facility, etc., the first person they're likely going to meet once they enter the facility is a nurse.
Right.
So, yes. So, since antimicrobial resistance is often discussed at global conferences and all that, how real is this problem in daily hospital care and practice?
You're right when you say something, it's a discussion that is globally ongoing. And find that it's a conversation that we are having. Initially, you'd find there were a lot of efforts in speaking with our clinicians on how to do antimicrobial stewardship, which is essential in preventing antimicrobial resistance. And one conversation that is going on at the moment, and the reach out activities that are happening, is we are now reaching out to the communities. We want to talk to them about the antimicrobials that they are buying off the chemists and pharmacies, that they should be indicated for every illness that they are going through. It's not just a drug that is taken without an indication. Secondly, you find that a nurse, being on the front line, is the one who is responsible for administering the medication. They have to observe the right time, the right dose, the right frequency, and the duration of the drug, because it will also contribute to antimicrobial resistance if not well observed. We promote appropriate antibiotic use, especially during Antimicrobial Stewardship Week. And in Moitich and Referral, we have nurses who are part of the diagnostic team committee, and they also are part of the antimicrobial stewardship committee. And we do reach out activities. We do audits of the patient's medication. We do annual audits of nursing care, including medication administration, including patient education. And also, they have been involved in the development of an antibiogram that is being used in the hospital to aid infection control and resistant surveillance. When you find that these antimicrobial stewardship activities are being promoted, upheld, and implemented by the nursing team among other clinical team members, you find that we end up providing patient safety management, which is committed to care of all patient staff and the environment. And also you'll also find that when we deliver the right treatment, the right dose, we are doing education on when do they buy these treatments, how do they take these treatments, what are the measures that are supposed to observe, and they are trained, because remember, these are patients who you might give medication today in the hospital, but then they will end up going home and continuing with this medication. What are the safe practices that they need to observe? And it will contribute significantly to the drugs and therapeutics monitoring.
Amazing. Well, you've mentioned one of the things that you actually advocate for is where the community, people are just making local purchases of antimicrobials, and they're doing that without a prescription, because I know that is a common mistake patients usually make when they are using both antimicrobials and other medications as well. So what are some other common mistakes patients usually make when they're using these medications? And I just want to clarify that when we are talking about antimicrobials, it is a combination of antibiotics, for example, augmentin, which is commonly known. It is other things like antivirals, antiparasitics, or dawa za minyoo, as most people know them, antifungals, etc. So antimicrobial is a combination of all. It's just that the one disturbing us the most, the resistance disturbing us the most is for antibiotics. But yes, what are some of the other common mistakes patients usually make when using antibiotics?
In addition to purchasing these drugs off the counter without a prescription, you'll find that they might not observe the duration of taking these antibiotics. They might take and not complete the dose. They might also get these antibiotics, and when you talk about them not completing the dose is when they feel they are better. They don't need to continue taking the drugs. And also they also feel that they forget the timing. And many times because they've been told to swallow 3 times, they don't observe the timing or the duration every 8 hours. You'll find that they're taking them without really counting the time or the hours that they're supposed to take them. We have done quite a lot of speaking through radios and through community channels, as well as holding community rallies and activities to be able to educate them on when should they take these drugs, what should they avoid.
Pata huduma za afya pia anapewa madawa. Unapata saa zingine zile dawa ambazo amepewa labda hata kunywa kwa usahihi, ama kuna makosa ya ile dawa vile anavyomeza na wakati anavyomeza na njia ambayo anameza. Pia hiyo inaweza kusababisha madhara katika huduma zetu. Ya pili pia ni wakati wa utambulizi, ya kwamba saa zile mgonjwa amekuja na kuna kulingana na ile mambo ambayo ameongelea ama amenenea, ugonjwa ulianza lini, siku gani, pia amepata symptoms kama gani. Hapo unapata ya kwamba yule mgonjwa asipoweza kujielezea kwa zaidi yale ambayo ametuelezea, hayo ndio daktari anatumia kufanya uamuzi na pia kumpa madawa. Lakini ni mzuri saa zile mgonjwa anakuja aweze kutuelezea haswa shida kabisa kwa upana, na pia aweze kueleza. Saa zile daktari anamuuliza kuna jambo lingine, anafaa aeleze mambo yote ambayo yanamuhusisha katika afya yake, ndipo daktari akifanya uamuzi anafanya uamuzi. Sasa shida nyingine ni hiyo kwa utambulizi. Katika utambulizi yale magonjwa ambayo mgonjwa
avoid, because one of the other contributing factors is the drugs that we are using, human drugs on farming, in farming, especially in poultry farming. And find we are going to take these farm products, the meats, and them being loaded with the antimicrobials. And now we load them into our own systems. What should happen? And one thing I like talking to parents about, and even the community, but rather how we introduce antimicrobials into the system of our children, into these bodies. And you find that we don't want the drugs that are on the lower class. We want antimicrobials which are on the higher end. And that because we think they're going to work faster, they're going to work well, they work better. And what we predispose these children to is antimicrobial resistance. As it will reach out times that they are sick, but you find the bugs or the infections that they're having are not responding to the antibiotics we are giving in the hospital. It's a conversation, Dr., that we need to talk about. It's a conversation that we need to be outspoken on. It's a conversation that we also need to not fear on looking at the impact. Even after talking, what is the impact of, if we have educated the population? We have reached out to the communities, the chemists and the pharmacists in the communities. We have observed and done audits within the hospital setup. And one thing that is very vital is for you as a clinician to do that audit even on yourself, looking at how am I prescribing or using these antimicrobials on my patients? And you find that in the patient safety unit and also the infection prevention control unit, we do a lot of looking at patients, the dose, the drugs they're on, how long they've been on them, how the patients are responding, what are the resistant bugs or organisms that we are able to find within the hospital setup from our patients, how we are managing those patients. But at the end of the day, we have to have a honest conversation with ourselves and do that self-audit on how we are doing the prescription. It is a responsibility that falls on the patient, it is a responsibility that falls on the community, and it is a responsibility that falls on us as clinicians.
You know, I was laughing because you actually hit the nail on the head. It starts
Yes.
with, I think the one thing that we should know, antimicrobial resistance and stewardship starts with us. I'm sitting here laughing because countless times, because I am a doctor and in my head I know I have peeped the throat of my child, I have seen the tonsils are swollen, and then you've decided, you've gone, nipe augmentin, kwanza you already know the dose, the timings, and everything. You've gone, you've mixed, you started giving. And this is me confessing that thing you said about self-audit. Because maybe I'm thinking of timing, long queues in a hospital. I don't know. I don't even know what I was thinking. So I used to, especially with my fast, do that severally. I chungulia, I check. And then I find they are swollen. And then that is me over the counter. There's actually a year I noticed when my fast was 3. Actually, yes, when she was 3, because now she's entered school. So the frequency of the tonsils coming back home when they're swollen was so frequent. So, which means the antibiotic intake plus paracetamol plus antihistamine was also very frequent because of self administration. Ilibidi nijiite mkutano because I was like, this is too much. I'm sitting and I'm like, even a month hasn't elapsed. Hadi nikakaa. So the time I went to the doctor, I was like, Ebu, tell me, when was the last time? When was the last time? So these are the times you've given her. And then I'm checking the ones I have given her. If I count, in a year, we have 12 months, but she's done about 7 times of antibiotics. I said, hapana. Hapa pia mimi namkosea. So do you know these days I will, okay, mama, what is the problem? Mommy, I'm having pain when I am swallowing. Okay. First things first. Is it cold and flu-like symptoms, etc.? Nampea maji moto. I will do a concoction, and then I tell her to just gargle some salty water. If it doesn't go down, sasa twende hospitali. Twende kama watadunga waangalie, because now we are advocating for, let's first know if it's viral, if it's a
Bacterial.
bacteria that has caused the infection, if it is a parasite, before you decide you're taking the medication. Now, there's something else you've brought that I love to hear about the interlinkage between venye watu hawamalizi dawa. Number two, the way we are giving our animals the same medication we are taking as human beings, which brings in the concept of also poor disposal. So unapata dawa haikuisha na ilikuwa inafaa ishe, actually with mixing inafaa ishe, but anyway it didn't get finished, whether it is the child or the adult. So where do we throw it? In the dustbin. Wengine tunatupa kwa rivers and what have you. So dogi itaenda kwa takataka, paka itaenda kwa takataka, ama the takataka will be picked and thrown somewhere. And then of course, combinations of all those, the different small dawas that never got finished end up now in our environment, as you rightfully said. The reason why this has resonated and is also passionate for me is because I deal a lot with something called leaky gut. And you could be wondering, hey, I'm eating so well, I'm doing a balanced diet, I'm exercising, I'm sleeping my best, but then my health is not in top notch. Every time you eat food, you chew it and it goes down to your stomach where it's digested and then it's absorbed through your intestines. Do you know you could be eating very healthy and your gut lining is not absorbing those healthy foods that you're eating because you have something that is called leaky gut? And remember, your digestive system is so important in helping you digest and absorb all the different nutrients and micronutrients that your body needs for each and every system to function. Your brain, your thyroid, your heart, your skin. So you eat and you notice you're eating very healthy, but you can develop things like headaches out of nowhere, tingling sensations. Your brain is not okay. You feel like you're very forgetful. You feel like you have cobwebs in your head. Your brain is foggy. Unajaribu kushika vitu kwa kichwa hazishiki. Umesahau ufunguo ziko wapi. Your skin will not be bright. You can develop things like eczema, acne that is refusing to go away. Uko na heartburn, unasikia inachomeka ikikuja hapa juu kwa mdomo. Ukimeza mara unasikia uchungu. Constipation, unatoa choo ngumu kama ile inakaanga kama ya mbuzi. Diarrhea, on and off. Uko na bloating, unasikia tumbo imefura. Have you ever been bloated to the point that you feel like you're pregnant or you're carrying something inside and you actually think these symptoms are normal? So that is something called leaky gut. It's like a kichungi that has holes. And those are the symptoms that can actually interfere a lot with how you're digesting your food, how you're absorbing your nutrients. So these conditions normally range from gastritis, ulcers, IBS. Kuna watu you've been told that you've got Crohn's disease, you have ulcerative disease, mara ni hemorrhoids, all those kinds of symptoms. So as we're celebrating Inflammatory Bowel Disease Day, if you have any of such symptoms I've mentioned, please reach out because it is possible to solve those issues. Come, we check and see what else could actually be going on with you. Once we understand what the root cause of actually all those symptoms are, because those are symptoms, and our aim is not to address the symptom. What we want is we actually want to deal with that root cause so that all these issues that you're having actually disappear. How do you get to the root cause? You need to work on your gut. And what does working on your gut look like? So if you already know you're eating a very healthy diet, introduction of things like pre and probiotics, if you haven't already yet introduced, are quite important because you could be eating a very healthy diet and maybe there's some nutrients that you're not getting in. So for example, some cultures don't eat meat, so you end up with a deficiency of something like B12 in the system because you're not consuming things like meat. Number two, water intake. At least 2 liters every day. Also, do you have enough digestive enzymes to be able to break down the food that you're eating? We assess your lifestyle, alcohol, smoking, among other mihadaratis. How is your sleep? And then we address all those things so that you can be able to deal with your condition. And one of the reasons why we are dealing with leaky gut is because of excessive antibiotic consumption. Sometimes somebody tells me, lakini doc, mimi sijakunywa antibiotic for the last 2 years. Sasa nikimuuliza tu ka history, maji yenye anakunywa, the kind of foods they are eating, because it will go back into the soil, into our vegetables, into our fruits, into our water. So now that's how it also truncates back to even those ones who are not commonly using the antibiotics. So this is usually a very interesting topic
Yes.
to have. Yeah.
Yeah. You
Amazing.
find that there is a very strong link between patient safety and public health in terms of antimicrobial disposal, incomplete treatment, use in animals, and antimicrobial resistance. This is because as much as when the patients have this tendency, or including even myself, at times you feel, do I really have to finish this dose? And I'm feeling much better, you
Oh,
know? And
yeah.
once you start feeling better, you are tempted to stop taking those antibiotics. And I will say, even some, leave alone even our own selves, some parents tend to give medication to babies because they are sick. And once they start showing improvement and like that they're better, they forget
Mm.
about it. And
Mm.
you remember it a day or two after. And did you even finish the dose? So you see, and one thing that people might not understand, some bacteria will survive the treatment if you don't finish the dose. That is one
Yes.
thing. Secondly, these bacteria that have survived or have thrived after the treatment, they're going to adapt and develop a resistance. And that means that it becomes tougher to treat when it shows the symptoms the following time. Then they require stronger medication. You can imagine a patient who might have gotten assistance with a cheap drug which costs 100 shillings. We are now going to a drug of 7,000 per dose because now we are out of the drugs that we can treat that
Yeah.
particular illness. Also, it can contribute to longer hospital stays and
Mm-hmm.
also increased mortality. So it is very important to finish the drugs when we are prescribed for. You have spoken correctly. Sometimes we dispose these drugs in the household trash, or probably you flush them in the toilets or the sinks, or they go to the drainage systems into the rivers. And at times, we are also tempted to store that drug for use when we are now not feeling better again.
Yes.
Yes, and looking at all this, it contaminates the food chains, our vegetables and fruits. It contaminates the soil. It will also contaminate the water systems. And this bacteria now, you find the bacteria in the environment. It imekuwa exposed to low concentration of the antibiotics, which will
Mm-hmm.
encourage development of the resistant organisms. And you bear me witness, flu, initially you treat it with just water, garlic, ginger, honey, and amoxicillin. Then people moved to treating it with amoxiclav or augmentin. And now we are where we are like, even if I'm taking that augmentin, it seems not to be responding. And it's just
Mm-hmm.
common flu. Yeah, you know. Then there is
Mm-hmm.
also the other giving human antibiotics to animals, where you find that the antibiotics, when they are developed, they are meant for human consumption. The
Yeah.
animals come in only during the trials. But then when you give them to the livestock, you use them in pets, you use them in poultry without a veterinary guidance. You just
Mm.
listen to what the other fellow farmers are saying and you just go ahead and use it. They develop the resistance of bacteria in those particular animals. Then they are also being spread to the human beings through direct contact, environmental contamination, or also food now. Therefore, it is something that contributes to antimicrobial resistance and it can be addressed by using one health approach. We have public health,
Yes.
we have human health, we have environmental health. All this can work in using one approach in order to be able to handle the resistance or the risk to the resistance. And you see the safety implications of doing this is that it will lead, if they are used improperly, it will lead to treatment failure. It will also lead to longer hospital. We have said about longer hospital stay, and the longer you stay, then the healthcare costs, and they're not getting any better and easier currently. the healthcare is very costly to any person who goes to seek it. And insurances are also becoming more expensive. Therefore, it is something that we need to work as a team in the community, in the veterinary offices, in the public health offices, as well as in the clinical environment.
Amazing. So what would you, as a person, if you could change one thing about how antibiotics are used in Kenya, what would it be?
The first thing I will change, I would say, is to tighten the safety link, to go on a policy text rather than a spoken communication. We have patients when they come to the hospital, they need safe care, and they expect in their most vulnerable moment to have someone more experienced to take care of them. Therefore, we need to develop policies, standards operating procedures that can be put in place, that can be implemented, because you can have a policy or a standard operating procedures and it is not being implemented. The other thing I can say is when you interlink and we work together as a team, when we have all these policy developers in our healthcare system, we need to work towards one goal, and that goal is towards patient safety.
And we have a very big role to play in doing that. And I have come to actually realize it is very possible to do what you're saying. It is very, very possible to do that. So, in your view, what does a truly patient-centered healthcare system look like?
True patient-centered approach is whereby this patient is in the middle and becomes the most important person in the healthcare system. When we stop looking at us and looking at what are the needs of this patient when they come to the hospital, what are their expectations, and what are the conversations we need to have with them. And that way, we are able to interlink care and multi-specialities to provide a one-stop shop, or rather a one-stop care for our patients.
So, how does that happen? Like in busy hospitals where systems are so stretched, and I know most of our systems are stretched. How are you able to ensure that the patient's voice is still heard?
I would give an example, Dr. Jacqueline, that when our patients come, we have a policy in our facility whereby we have put all the reach out contacts, we have put a QR link that this patient can give feedback, we have suggestion boxes everywhere. We encourage our patients to talk to us, whether they're happy or they're not happy, whether they have concerns or they have complaints and compliments. We want them to be able to speak out to us. We want to be able to hear them. We want to be able, because at times we have this perception that they have come to us, so they have to follow what we are saying, or we are the experts. But remember, a patient is the most is the most central person in their own care.
Yeah.
They come because they want help. They come because they want to be heard and be assisted. Remember, in my most vulnerable moment, I wouldn't want to be seen as being that vulnerable. But I have come. And one thing I like talking about to my fellow colleagues when I'm doing sensitizations on communication, soft skills, and emotional intelligence is that we need to be able to understand this patient probably has gone through a lot of healthcare facilities seeking assistance, and then they have landed on our door and they want help. They might not understand the implication or the impact of them coming to the hospital, or what they expect, the feedback they want to be given. But once we put them there and we work as a team, teamwork is one of the things that we need to look at. Active listening. We need to listen to them more, applying our hard skills and soft skills together. Then we are able to offer patient-centered care. Being able to meet them at the point where they might not want to agree with us. how can we work together? How can we guide them towards the care that is optimum for them and will lead them to a leading quality life? And remember, healthcare systems are very complex. There is the systems, we look at the systems, we look at the environmental factors, and we're looking at human factors. And the three, for them to work together and to work to their best, we need to ensure that we are open to creating rapport, to giving open suggestions and recommendations to these patients, and also being able to talk to them about why they need to be followed up in a healthcare system. Also having pathways that guide them through the complex system. Yes.
Amazing, Doris. If I had claps, I would just be like, make Doris the next the director of clinical services at the Ministry of Health. You know, I've been saying and having an internal conversation with myself that we have such brilliant minds seated in offices, seated in, you know, like in your hospital, seated at home, who have the ability to change our communities, our countries, the African continent, and globally. But we are sitting on that talent and not letting these people actually advocate for its patients, its citizens, its population. And if we just let people like you tukupea tu mwanya, but I know you're doing and I totally understand, because I do understand where you also sit, because you're also doing something where you sit and not just something you're doing a lot. But I think you understand me when I say at the higher levels, at that intricate part, because at times there's so much effort we put in. You're talking about policy, patient advocacy, patient safety. Sometimes you find it's being felt at the grassroots level, but then there are certain other people who are not getting these benefits because Doris Kinya is at MTRH. But anyway, those are my opinions.
You see, Dr. Jacqueline, one thing that is very important in our healthcare systems and in any given healthcare institution is the buy-in and the support of the board and the hospital management. Because if they are able to buy in onto the policies, because for example, we have policies on referral systems in our institution, in Moi Teaching and Referral Hospitals. We have a policy on patient safety. We have a policy and an antibiogram for Moi Teaching and Referral Hospitals. We also have a working and a very functional infection prevention control unit. And everything that they do gains support of the management in a way that the clinical audit, once we are able to look at every patient that comes into MTRH, that they are important. You as an individual, we don't look at you as a patient, we look at you as an individual with needs. And we audit the care that you are able to get from the time you came into the hospital to the time you left. What was the kind of care that is audited in clinical audit units? And then we learn from that. We learn lessons from that. What were the gaps in care? What were the areas of improvement to similar patients, and ensure that they are satisfied with our care? These are honest conversations that we have within our institution. And when we have this conversation, we give feedback to every department where this patient was handled. To every, if there were areas of improvement, we have honest conversations with them. They give us a feedback on the actual what happened. We get to understand that. We write reports all the way to the board of management, all the way to the CEO, and we learn from those ones. They guide our evidence-based practice. They guide our continuous medical education. They guide the individual improvement programs. And you see, all these are able, it's because we have a supportive system, a system that is able to see the need and the basis for why we need to work towards the same goal in providing compassionate and patient-centered or family-centered care in the community. Currently, the Ministry of Health is developing a health safety patient bill. And you see, it is at this point that in MTRH, it's something that started in 2019. And we have been able to grow to a way that we are not we are looking at no shame, no guilt, but by the care that you're providing, we are able to understand what can go wrong, looking at systems and what can go wrong and how do we stop it from going wrong.
That's a very good example of how your work at MTRH has also borne fruit now nationally, and more so will happen globally. Now, I want to shift this conversation a little bit. So brace yourself for some interesting personalized questions, right? So I know your master's
Yes.
journey took about 10 years. Were there moments where you felt like you want to quit? And if not, what kept you going?
Many times, Dr. Jacqueline, so many times.
Yeah.
I would go to class and I was among these, they were looking very smart people, let me say that. Smarter than me, more seasoned. And I was like, will I really be able to compete? Am I really cut out for this, or I'm just running so fast? I need to stop. But then I registered. I was encouraged. I got a mentor who would tell me, you just go on and let's see what will happen. And I would go and I would move on. And I remember I wished to complete as fast as I could. And along the way, I met with some challenges. I remember I defended my thesis, and this is the time that now I got an accident. And then along the way, I was blessed with my children and with my twins. And I'm like, okay, so maybe I'm not supposed to finish this thing. I should just stop it here. But I kept on pushing, and having a very supportive partner makes a lot of difference. Because I remember I would always be pushed. What are you waiting for? Go back to class. And it helped me to get there after 10 good years.
At least you ended up finishing. Most people, they start and it never finishes. It's just a hanging paper. And I think we are also lucky, let me say, in this context where you can be allowed to push to 10 years. Like bado hujamaliza, lakini hawakufukuzi shule. Ni bado hujamaliza. Yeah. You stay 2 years, they hata kama you had paid school fees or anything, you're out. You'll now come back and start again.
Yeah, and I remember being called also by my supervisors, and they were asking, "Where are you? Can you come back to school?" And I remember I would think, why do they want me to finish this thing? But also I realized it's not just me they were calling. They were, we were among the pioneer classes, and they were very committed. And even now I see them calling. And I remember even once we were preparing for our graduation, they would ask, where are the others? Can you tell them? And I realized life has a way of, it's never a smooth sailing. You have to be very determined and focused to get to where you want to go. And there's so many things that can derail you from a target that you want to reach to. It's about staying focused, never giving up. Many times that is something that, and you see, it's adult learning, when you get to that place where you have so many responsibilities, you're a career woman, you are a mother, you have so many responsibilities that are waiting on you. And then you're a student, and you have to meet all this imbalanced life very well.
I want to speak to fellow female entrepreneurs. How are you guys hacking in your different capacities and roles amidst the different responsibilities that you have? How are you hacking this thing called entrepreneurship, owning a business, owning something that you call your own, that you have to wake up to? You're the CEO, you're the founder. How are you hacking it?
It's never easy, but with the right mindset, let me call it just the right mindset, attitude, you can reach as far as you want to go.
That's beautiful, because my next question was going to be, how do you even balance all those things? And now you're even going to do a PhD, Doris. Yawa.
One thing that I had to make very tough choices, you know. I had to make tough choices.
Yeah.
I had to move near my workplace. I live near my workplace. I am able
Okay.
to be a mother, to dedicate my time. I remember there's a time that I lost touch with my children, especially my firstborn daughter, and she felt that I was not paying enough attention to her. And I had to make changes to how I was doing things, to consciously create time for her. And remember, now I'm balancing her and also the other children. So one thing is moving near to where I work helps me to be able to balance out very well. The time works best for me. I created consciously time to drop them to school. I drop them and I pick them, and this makes me able to bond with them and to maintain a relationship that has an impact. You know, many times we might blame our work or our commitments to the time that we spend with our children. But
Yeah.
in a program, I went through a women in leadership program that really guided me and made me see, how do I become a woman who is able to meet my life responsibilities as well as be able also to get my career advancement and to also be a woman of impact, including in my own home.
Where
Yeah.
I think I should call you for this Mother's Day to speak to women, because most of the times you find more so often we give up as opposed to driving ourselves, pushing ourselves, being patient with ourselves, being resilient, and doing that thing that you've always wanted to do. And then we say, these things under the rug. Or you also, other than sweeping them under the rug, you decide maybe you wanted to reach Mount Everest. You decide, at a longer note, iko tu sawa.
A woman is a very strong person. A woman is a miracle by herself. Let me just say that.
Yeah.
The worst thing that we do to ourselves is we stereotype ourselves to how much we can achieve in our life. During the program, I learned, and one thing I learned is the conflict resolution. And the biggest conflict is dealing with yourself, dealing with your thoughts. You many times as a woman, you'd feel you're limited because you have too much to do. But there is always an opportunity for growth. So yeah, it's something that we need to deal with ourselves first, and to realize the impact that we can have, not just
That's
in our own lives alone, but even in the lives of people who are following us.
that's very true, yeah.
Yes.
So for you, being the mother, you're the nurse, you're not
Mm.
wanting to do a PhD, you're in charge of a department. What does a perfect day off look like for you, off work?
A day that I get to spend with my children, I'm able to get out with them, especially out of the town, and also be able to really to actually bond with them, talk with them about their lives. It's a perfect day because it's something I hardly get a lot of time to do, but it's a conscious thing. It's something that I consciously have to plan for. I make a plan. The way I plan a day at work, or I plan a day in the community, or in the functions that I have to play in the society, I also make a conscious plan on how to spend a day with them. Get out of
Nice.
town, play with them, give them the attention that they need, because they are growing and they will not understand why you're not giving them that attention, why you're too busy for them.
All right. This is now us coming to the tail end of our interview. What do you think the future of nursing in Kenya should look like? And how can community focus centers like us, like Case Wellness Center, collaborate with large hospitals to improve patient outcomes?
The future of nursing is technology based. We are currently moving towards technology advanced nursing, where we are documenting online. We are doing a lot of things on the systems. And one thing is nursing is meant to be, it's a touch. It's a life you touch. It's a life you interact with. It is more of physical rather than technology. And the future is being able to balance and being able to tell when that human touch is very, very much important when we are dealing with our patients. The future of nursing is every nurse being able to understand, I would call them information systems. Uh, I considered doing health information systems as a side course, but then I realized it is more than that, because it's where we are heading to. It is where our mind should be set up for. It is also being able to realize that nursing can be driven towards preventive care rather than treatment, whereby nurses become patient educators or even community educators. There is a course we did that is called community centered care.
Mm-hmm.
And in this particular course, I think that we should aim to go to that direction, because we are finding a community where we have so many people with chronic illnesses. How do we prevent it so that it doesn't get to where they are coming to the hospital and they need a lot of assistance in meeting their activities of daily living? Could we probably be needing to do the assessment, the evaluations, the nursing diagnosis, the nursing interventions that we do in the hospital? Can we intervene using the same approach in the community so that we do not have very many people getting sick, or if they develop the chronic illnesses, then it does not progress so fast because they might not understand what is required of them.
All right. So this means there's a lot more work coming for me, because I'm in the preventative space, prevention and management of chronic diseases. And I usually say that it is very possible for all of us to be able to prevent a chronic disease, because most of the times, even though you're genetically predisposed, that predisposition may or may not be triggered. So this thing we're seeing, where there's the very high rise in the incidence and prevalence of non-communicable diseases and these chronic diseases, is something that we can actually work on. So it means our centers will soon be very busy. Although I know that behavioral change is also something that we need to communicate to people, because as people, we have a tendency to only visit the hospital when either we are in dire need, or you have seen something physical on you, or you're being unable to get out of bed. You know, we have this Kenyan concept of what I don't know will not kill me. So that's why most people never go out seeking health assistance. But every single day we educate and we say one step at a time. So that continuous education and impacting of knowledge and information always has an impact, just as you've had an impact in the role of advocacy, patient safety, AMR, and antimicrobial stewardship. So if a young nurse somewhere in Kenya is watching this podcast and feeling overwhelmed by the profession, what message would you want them to hear today as you give us your final remarks?
One advice that I would like to tell the upcoming nurses is nursing is a calling. You have to really love it. It is a profession that goes beyond career. It is a profession that goes beyond the physical. You have to be able to change and to impact human life, as well as make them get by the quality services we offer, and how we offer this care, compassionate care. So it goes beyond the perspective of it being a career. It is a calling, and you never give up. It is not a career that would let you down at any given time. It has a lot of satisfaction. I feel very satisfied when a patient says, "Thank you, sister." Like, I feel I've really touched that life. It's more than the salary that I get. You are able to feel that you have made a difference in the life of that particular person. So as a nurse, it is a calling, it is worth it, and it is an amazing, amazing opportunity to touch lives and to impact on them. Thank you.
Thank you so much, Miss Doris Kinya, for accepting to even be on this podcast, the Case Wellness Center podcast. Today we were discussing nurses as advocates for safer care. We are really honored to have you on. And I think futuristically speaking, we can collaboratively work together in the space of patient safety, advocacy, chronic diseases, antimicrobial resistance, and stewardship, because there are different spaces we can actually speak on as healthcare workers, and also in the space of us just being women. You know, these days, sometimes you find women, we're not seeking each other out. And I usually say, I think we're each other's biggest supporters. We're not seeking each other out so that you can learn from. Doris has 3 children. She has a master's. She has worked in a level 6 facility. So she has experience. She has the know-how. So what can I learn from her so that I am able to be a better version of myself, so that I'm not also able to make some mistakes that can also be avoided, because mistakes are also possible, but which are those ones that can also be avoided? Because as women, we are multifaceted. These are not the days where we were in the kitchen and cooking and rearing our children. These days now, we have very many responsibilities. But I love the fact that despite all the responsibilities that you have, haununguni, that is something I have picked from you. Haununguni, you're like, okay, this is it. Twende.
Right.
So,
We are
yeah.
eagles. We have to soar high.
Yes, we do.
Yeah.
Yes, we do. So thank you, Doris. Na ukiomba utuombe.
Sana. Thank you, Doc. It's been a pleasure to meet you.
Same here.